Elizabeth Betty Buck with us. We have Eric Morset with us, and we have Barbara Wall and myself, Alan Silverstein, so we have a quorum today. First order of business is approval of the December 16th meeting. I need a motion for approval.
I'll move to approve.
Barbara? Second, please. Eric? Have a second. Motion is second. All those in favor signify by saying aye. Aye. Opposed, same sign. Motion carries. Executive Director's report, Mr. Kelly.
Thank you, Mr. Chair. Happy January in 2022, everybody. Starting our beginning of our second year, and it's pretty neat. Excuse me, we had a pretty interesting, a fairly busy period of time since our last meeting in December. We had 8 incidents for which people were charged or referred, either for charges or referred to local liquor boards for other actions. Of those, 4 of them were strictly alcohol-related incidents. 1 of them was an alcohol and tobacco-related incident, and the remaining 3 were tobacco incidents. I'll tell you about the seizures first. In OTP, other tobacco products received over nearly 9,400 sticks of other tobacco products, 26 packages of cigarettes, 116 containers of spirits, 605 containers of beer, and 2 containers of wine. And of those 4 alcohol cases, what I kind of wanted to draw your attention to with those is that 2 of them, well, 3 of them actually, total 3, were some kind of things that are a little bit unusual for us. One is there was an instance where a wholesaler made a delivery to a retailer, or at least it made a delivery to someone who didn't have a license. Likely, this was somebody who was a retailer who didn't have the license any longer. Either they chose not to have it for whatever reason, were ineligible to get renewed. But in any event, the wholesalers are obligated to check and verify that whoever they make deliveries to have a certified active license. And in this case, they did not do that. So they have been charged, and we are working through that process internally. In 2 other instances, again, these are cases of wholesalers committing acts that they're not supposed to do. Wholesalers can't give anything of value to a retailer. That means they can't give them something physically, an item that's physically usable. It means they can't give them help or work or do anything other than the very strictly laid out provisions that are in the law and in our code. In this instance, we had 2 different wholesalers that went to retailers and were stocking shelves for them. They can't do that. What wholesalers may do is drop off product in the store, of course. They may set up displays, set up a display in the store, but they can't come back and replenish the display. They can rotate stock on shelves if they have dates that would go out of it, become expired. They can do that, but they can't come there and just give labor away by restocking shelves. And oftentimes during the holidays, some retailers might look to some of their wholesalers and see if they can't get a little help stocking shelves. That's what we think happened here. So 2 of those are for that too. And so I bring that out because it's really different than the usual, which might be purchasing, usually it's what a retailer's doing, purchasing from other than a wholesaler, making a sale they shouldn't make. But in this case, it was a wholesaler doing something a little bit wrong, either selling to an unlicensed individual or entity or providing some other services. So just interesting. And these will carry out through our system. Just to bring your attention to it, on February 21st, that's what is generally considered, and Betty's very familiar, Commissioner Buck's very familiar with this, Alcohol Day in the House. It's President's Day. Every year during President's Day, the House has Alcohol Day. That's a day where you bring your lunch and your dinner and coolers of water, because they are usually very long days where all of the alcohol bills receive their hearings. And so this year it's going to be virtual. It was last year too. And the nice part about it being virtual is you get a seat if you want. And it didn't take like 6 hours or 7 hours like they ordinarily do for other years. But nonetheless, you might want to tune in on the 21st and just see what's going on. Also, since the General Assembly started a little over a week ago now, there have been 9 alcohol bills that have been introduced. 8 of them are local bills, 1 of them is a statewide bill. I'll talk about the statewide first. It's actually a bill just to create a study. This is to study minority involvement and historic involvement in the alcohol industry. So the governor's office is assigned this responsibility. The ATC is one of many people who are to participate and help along with the study. I believe it was due at the end of this year, if it passes. But we're not obligated to staff it. We're just going to provide information, I'm sure, as some historical context. The other 8 are, I mentioned, local bills, and just briefly what that means is, and if you already know it, I apologize for oversimplifying it, but there's usually statewide bills or local bills. Statewide bills get a lot of consideration and scrutiny before they become passed or not. Local bills get some level of that scrutiny, but frequently A local bill is simply a bill that one particular county or jurisdiction, Baltimore City or one of the counties, would introduce that only impacts that county. For example, Montgomery County might want to have alcohol in movie theaters. So there's a local bill by the local delegation that all supports this. This is, we want to have these movie theaters with alcohol licenses in them. Please pass our bill. If the local jurisdiction is in favor of it, most of the time the General Assembly just gives them a courtesy and passes the bill. And the reason I said that's significant is we see more and more local bills now each year where they don't introduce a statewide cinema bill or a movie theater bill. They do it by jurisdiction. Growlers, I think, are maybe a good example of that. These resealable beer containers. It started off in a handful of districts, and now it's pretty much statewide. But little by little, you might see it happen one after year, and it kind of gives you an idea of what the trend's going to be moving forward. The tobacco bills, both bills are very similar in what they do. One's a statewide bill, one's a local bill. The local bill is for Baltimore City only. The statewide is for everybody, obviously. And they both do the same thing, though. Right now, the state has the preeminent authority of regulating and enforcing the state, creating laws for state tobacco usage. These two bills would allow Baltimore City specifically and the entire state, the ability to enact their own laws and do their own enforcement on tobacco violations. Caveat being that anything that they enact has to be at least as stringent as existing state law. So they can't make something less stringent than state law, but with these bills, they would be able to make something a little bit tougher, and that they would have the authority to carry that out as well. And then if I could, I just wanted to just very, very briefly introduce one of our representative from the Maryland Department of Health, Dana Moncrief. Ms. Moncrief's been a 15-year veteran of the Department of Health. She spent the entire time in the Center for Tobacco Prevention and Control, all of that. She currently serves as its director. She holds a master's degree in health science from Johns Hopkins Bloomberg School of Public Health, a bachelor's from Penn State University, and she's a certified health education specialist. Interestingly also, because I just had a completely unrelated question of her recently, she's also the state lead for the pediatric initiative of COVID vaccines for, I'm not saying the proper order, but she's the lead for making sure that we figure out a way to help get the vaccine to pediatric patients for COVID. And I just happened to have one of our industry members happen to contact me yesterday and said, I'm in trouble. My daughter needs help. She's allergic to the vaccine, and do you have any way we can go? And I was able to reach out to Dana, who's working to help us get some information on that. So it's just happenstance that we have another great resource here for a variety of reasons. I say welcome aboard, Dana. I'm glad to have you. And I'm sure the other commissioners are glad to have you here as well.
Mm-hmm.
Mr. Chair, when we get to new business, I have just a little bit. I'll bring you up to date on another issue, but that would be the standard report.
Can I ask a question?
Sure.
And I don't know if I'm allowed to know the answer, but Jeff, you had to know I was going to ask you this. Were the two distributors that stocked the shelves competitive distributors in the same store by chance?
I think that's a fair statement.
Okay, yes. That's what I figured.
That's a fair statement. But you know, interestingly, yes, that's yes. But I'll say this: we are, you know, now that we're kind of aware of how this happens, it's going to be a little bit easier for us to spot it in other stores now too, because this really opened up new avenues of investigation for us. So I think we're going to be a little better at being able to crack down on this also.
Because it happens a lot.
That's my understanding, and I'm hoping that the industry will. The industry's always so. And I'll just say this: the industry's always been very good at self-policing, but this is one area they've never really done a pretty good job at. Everybody's been quiet about this, and probably because it's more widespread than we may know. But I think we've just gotten a little peek behind the curtain, if you will, with this most recent case, and that's why I'm saying it publicly as well as to those industry members who are listening in today. You know, you're forewarned. You can't do it, and we have ways of finding out what's going on now. And
I don't think it's always been like that. I think it's just gotten worse lately because some of the bigger retailers are just putting a lot of pressure.
I know that. I mean, I'm hearing things now on busy weekends. They're putting out all calls to their solicitors, who are the salespeople, and saying, "I need help stocking my shelves this weekend." They're empty, and people are stopping what they're doing and going in to stock the shelves, which has never been and is not legal. But people are doing it because, quite honestly, the pain of doing it hasn't necessarily outweighed the pleasure of getting paid more perhaps for doing it. And our job is not to administer pain or pleasure, but to make sure that all the rules are being followed equally. And that's
right.
What I'm doing.
Thank you.
Sure.
Thank you. Brooke is here from the Maryland Department of Health. You have an update for us?
Yes, hi there. Thank you so much for having me. Brooke Torton, Managing Director of the Legal Resource Center for Public Health Policy, funded by the Maryland Department of Health. And Jeff, you took care of some of this for me, so I'm going to be quick. I just wanted to provide a brief legislative update, so I'll just provide just a tad more detail, Jeff, and add one bill to that. So Jeff referenced two bills. One is just Baltimore City, and one was related statewide. And this deals with tobacco preemption at the state level. So preemption at the state level, preventing locals from passing laws, generally speaking, relating to tobacco in their jurisdiction. So the brief background I want to discuss is in 2013, there was a court decision, and it's as a result of this court decision that we are in this position where we must go back to the legislature. The legislature is the one that has to give the authority back to the locals. Prior to 2013, locals for a few decades were passing laws relating to tobacco, but it was a court decision in 2013 that put a stop to this essentially. So there is a movement to get this bill passed based on the needs and the desire of locals to get have the ability, the authority to pass law that they feel that they're in the best position to kind of know what's happening in their communities, and they can kind of come up with solutions that's impacting their population. So that's just a little bit of the background as to how we got to where we are. The second piece I want to mention is there is a bill that is related to authorizing pharmacists to furnish nicotine replacement therapy to people that come to them directly. So that is a bill. It's SB 62 and HB 28. It's actually being heard today at 4, the House version, at 4 o'clock today in HGO. I don't believe the Senate bill has a hearing date yet, but essentially the idea of this bill is that it removes the barriers where patients have to go visit their doctor, get a script, then go to the pharmacist. It's just to kind of make it more accessible and easier for folks to get access to NRT. And this bill has been introduced in prior years as well. So this isn't a new concept. And so look out if you're interested. The hearing should be up around 4 today. If you visit the legislature's website, and you can go ahead and listen if you're interested in that.
Thank you very much, Brooke. We appreciate having you join us today. New business, Jeff.
Thank you. First is just to say that we may be able to do a presentation on something that's really becoming up and coming and a concern perhaps, and that is synthetic tobacco. So what we're hoping is to get on the agenda for next month, synthetic tobacco, what it is, how it's impacted, if it's something we're going to regulate or how we're going to do that. And I would just say a couple of years ago, and you're probably all aware of this, synthetic cannabinoids came out. So these were synthetic things that acted a lot like cannabis would act, but they weren't illegal because cannabis was illegal, but these chemical compounds were not. So the General Assembly started learning what the chemical compounds were and then writing laws specific to them saying, and the chemical name was in the bill saying this is no longer allowed in Maryland, it's an illegal product. So the wise chemists went back and changed that just a little bit and made it something else. And so next year, another bill, and we found ourselves chasing all of this. Then we ended up with a more general bill that simply said if it acts like a cannabinoid and it's kind of like a cannabinoid, it can be enforced. We can go ahead and enforce it. The problem with that, it's a great thought, but the problem was you still have to have lab work done to say that it acts like a cannabinoid and it's kind of built like a cannabinoid, and there wasn't any lab work available for that. So it became a little ineffective in how we could enforce the synthetic cannabinoids. So now we're going to be dealing with perhaps synthetic caffeine, tobacco products rather, and I'll tell you that there's a lot of interest from the General Assembly. I've gotten quite a few calls about it generally, and Dana and I were talking, we might go to do something next month that will address this a little bit more and give you just more of a sense of what's on the radar and what may be coming down the pipe. That's item one, and just the two things that are off business here. I happened to meet a week ago with the chairman of the Economic Matters Committee. It's brand new chairman, Chairman C.T. Wilson from Charles County. Seems like a real nice fellow. Absolutely supportive of this commission. Said if there's anything he wants to do it to help us. He said specifically, if we have any legislative needs this year, to come to him directly. He'd be more than happy to introduce bills for us. There's a timeline on that because it's all got to be done like within the next few weeks. If there's something that's burning you guys and you want to talk about it, please let's talk about it. We can do that offline. And if it's something that we want to take to him and ask him to consider a bill for, it's great. but I think he's going to be a terrific partner. His committee regulates alcohol, tobacco, and a whole host of other things. He's got a real interest in this. And he's also going to be responsible for drafting policy for cannabis if and when cannabis is passed, which, you know, it's subject to referendum this year perhaps. And if it's passed a referendum and they decide to enact it, then he's going to be developing policy on that. And he's already kind of laying that work out, that he's going to be leaning on this commission very heavily for input and wants all of our concerns and worries about tobacco and alcohol out of the way so we can focus on cannabis full time when and if this should pass. The last thing I'd like to mention in the new business is yesterday, Governor Hogan introduced his budget allowances to the General Assembly for consideration. It's got to go through a series of hearings and whatnot, but we got ours. Now, the way the budget works is the Department of Budget Management sends us a number, and the number they sent us originally was roughly $3.7 million. So they say that's your target budget. Figure out a way to spend it and see if you need that much, and if you need more, you're going to have to do something different. But that's what you're getting. We think preliminarily, send us in your budget for that. So we do a budget submission for that. And then we were allowed to do something called an over the target budget, which we've only been around now for a year, and we didn't really know what we were going to need, and we didn't have budgeting allotments previously because nobody knew. We have a better sense of where we are and what additional needs we had. So we supplemented our budget with what's called the over the target budget, and we asked for a certain amount of bodies, people, and some equipment to support that operation. And I'd have to say that the Department of Budget Management and the governor were very generous to us and have included in their allowance for us in the General Assembly 7 additional agents and 1 additional administrative position, and the subsequent funding behind that we'll need to equip and train and carry that out. So I'm just thrilled that we got that. I mean, I really am. It amounts to an additional, almost like $1.6 million additional. So it's almost a 50% increase on what we had to get more staff and more people out there, because that's where we've really been short. We don't have the agents in the field. This will go a long way. Of course, to the extent that it passes, it doesn't take effect until July 1st, but I hope to have a list lined up and ready by July 1st before we get this through. So that's it, Mr. Chair. Thank you.
Does any of the other members of the commission or anybody else have any questions or any other business before us? If not, I take a motion for adjournment.
So moved.
All right, Betty Buck, I need a second. Second, Eric Morset. Motion is second. All those in favor signify by saying aye.
Aye.
Aye. Okay, opposed, same sign. Want to thank everybody for joining us today. We'll see you next month. Thank you. Take care.
Thank you.